then course evaluation.
Okay.
And that will bring you to your list of all your classes.
And Nikki also said in the chat that there was an email sent directly to your Fortis email on Monday about filling out evaluations.
That was the first place I looked and I did not see that.
So they had forgot to hit send with Eugene. Sorry.
Mhm. It's all right.
Can you find it the other way through your accounts?
I'm still looking now.
Okay.
I do not see it.
Okay, so how is everybody doing for a Wednesday of week 5? How y'all holding up? How's everybody doing?
All
I
right.
know you're incredibly busy. I know you are. So a couple of house overwhelmed. Yes, yes. If there was ever a term to have good time management skills, it would be this term, right? But you're in the home stretch, right? And everybody needs to get over the finish line this term with this class. Okay. Had really, really awesome grades on exam 1 and hoping to get that with exam 2 as well. I kicked off the reviews this morning. I had a review this morning, so I will post that along with this recording for this class. I might post it separately so you can keep track of them. Anyway, this is the week of reviews for exam 2, right? And so please go back and look at your schedule. We sent out a schedule, I think at the beginning of week 2, a master schedule with all of the instructor reviews. There should be, I believe, 6 of them happening between today and Sunday. Okay, and I think I was the first today to do it. So you have 6 opportunities, now 5, to attend live reviews. And then as each instructor, like exam 1, posts their review, I will post it for you in the announcements. So you should have 6 recordings as well. All right. I mean, it's always great. Best case scenario is to get to a live review. If you absolutely can't, then please take advantage of the recordings. Okay. So that's it with reviews. I will probably open the exams to download this weekend. You know, Saturday morning I usually do. And so again, just make sure you have it downloaded before you come to class next Wednesday. So next Wednesday at this time, we'll be taking exam 2. Okay. I'm still open to anybody who wants to review exam 1. Even if you got above us, oh, I got a couple more people coming in. Okay, so for the few people that just came in, put your name and your campus in the chat, please, for attendance. And then Ernesto, I think it was in Chelsea, if you wouldn't mind filling out the course evaluation, the mid-course evaluation, that'd be great. You can find it under your account section in your shell, and then it's under evaluation. So that'd be great. So reviews, I'm still very open to review anybody who wants to review their exam. If you got in the 90s, the 80s, 70s, if you got below a 78, you've already heard from me that I really encourage you to review the exam with me. If you got above a 78, I'm still open to review any exams. Okay. I have students that get in the 90s and want to know the 2 or 3 questions they missed. Okay, so please reach out to me. I think on, was it Monday? I didn't send it to you guys. I sent it to my PN group, but just reach out to me and we'll set up a time to review the exam if you would like. Okay. We did evaluations or reviews. The Thank you to all the groups that are sending me their infectious disease topics. Appreciate that. If you haven't, if your group hasn't sent me what you're going to be doing, please do. I wanted it by yesterday. I got a lot of emails yesterday, but there's still some groups I haven't heard from. So if I haven't heard from you, please in the next couple of days, get me your topic. What else? So today we're covering environmental health, epidemiology, and occupational health. Okay, chapters 8, 10, and 32. And then these are the last 3 chapters that go with your exam 2. Okay, so what I'd like to do is go through the content and maybe try a little bit of a week 5 Kahoots a little bit, but then I would also like to pull up the study guide. Okay, and go through that briefly so you can see how it's organized. You guys all got the study guide for exam 2, right? And so I'd like to take some time and review that. It's not a formal review, but I'd like just to show you how it's set up. How does that sound for a plan for today? Okay, vulnerable populations assignment due in week 9. Hopefully you've started thinking about it. It's not an assignment that you can start in week 8 because it requires some research. So please make sure you're thinking about that. Okay. And if you need any guidance or help or want to bounce any thoughts, ideas to me, I'm happy to meet with you. Okay. Any questions before we get started? Okay, let me share my screen. I wanted to do real quick. Your discussion question that's due this week has to do with epidemiology. So I just wanted to highlight that. Okay, so this is a case study. Okay, it's an outbreak case study at a university. So it goes along with your epidemiology chapter, which is chapter 10. Okay, so I just wanted to point that out. You also have an NCLEX assignment. Let's see. You have an NCLEX assignment that's also due this week. And the content to select is right in the module. Okay, and then we'll do our attestation at the end of the class. Okay, next week, week 6 is an exam week. So, but you still have a discussion question next week. Okay, and then I will cover the content for week 6, which is moving into exam 3. I'll cover that in week 7. Okay, we'll do 6 and 7 together. All righty. So let's talk about environmental health. What do you guys, environmental health is a critical part of community nursing. Okay, why is that? When you think of environmental health, what do you think of?
Like safe roads, safe parks for children to play in, eliminating, risk for illness in the community.
Mm-hmm. Do you think of things like air pollution, water contamination, pesticide exposures, lead paint? Think about where you live. Okay, again, please review the objectives because that's what I focus on in the chapter. Okay. I did highlight a couple of words that are going to come up in this chapter that are going to be important to know. Your we're going to get to epidemiological triangle in chapter 10, but it comes up here in environmental health as well. Okay. So environmental health, I believe we take for granted. Well, first of all, When I think of talking about environmental health, has anybody ever seen the movie Erin Brockovich? What was Erin Brockovich about? Nobody has seen that movie?
I've seen that movie, but it was a long time ago. Aaron
Yeah.
Brockovich was fighting for was it pollution in the land and the water,
The one,
and it was making a lot of people sick, and she was the one that was really,
Mhm.
I don't know, fighting the fight.
Right. So it was a very high, it was a very important case about environmental disaster. Okay, the water was contaminated, the soil was contaminated, all these people in Texas, in a little town in Texas, were getting sick, kids, adults were getting cancers, and it was an example of what happens with an environmental disaster. And it's a really good movie addressing environmental health and environmental risks. So we know that when we talk about environment can be different places, right? It can be your home, your schools, your workplaces, your churches, social organizations. Okay. Every place has its own risks. All right. It's important for us in the community, as we're out in the community, to understand which areas have which risks. Okay, maybe schools have high risks of lead poisoning. Okay, what if you live near an airport? Is the increase in air pollution? What if you live near water, risk for water contamination? What if you, I mean, think about your environment. We all think about where you live right now. I can speak for myself. I think I take my environment for granted. Do I just assume that the air quality is safe, that the water's safe, that the soil's safe? But think about all the environmental risks we have in our communities. Okay. So as nurses working in the community, we need to be able to identify, assess what risks there are in any particular community. Okay. And we also need to be advocates for safer and healthier communities with regards to the environment. Okay. We talked about drinking water, air, pollutants, use of pesticides. And, we talk about use of pesticides when we talk about farm workers, but that applies to every community. We have pesticides in our homes, cleaning. We have pesticides that we use for gardening, right? Some factors that impact environmental health: genetics, socioeconomic status. Okay, so we have to be able to know how to do an environmental assessment. Okay. And we know that environmental exposures are rarely limited to one location or source. Okay. And we talked about pesticides in the homes, the herbicides in the gardens, pesticide residues from fruit and vegetables that we buy, antimicrobial soaps. Environmental risks are everywhere. So here's what we have to understand. Box 8.1, the health competencies that we need to have as nurses working with environmental health in our communities, right? We need to understand our populations and what environmental risks they face in a specific community. Is it an industrial community? Is it an agricultural community? Is it another type of community, that a transportation hub? Okay, so we have to be able to connect the dots of the community we're working in. What are the environmental risks? Okay, we have to be able to do an environmental health history, and I'm just going through the ADPI. Recognize the potential hazards. Okay, have the appropriate resources and referrals for families or clients or individuals, families, if they've been exposed to something or if they're at higher risk for something. We're essentially advocating for our community. We're advocating where we'll talk about risk communication, about how do you communicate with your population risks. And then as nurses, we need to understand the policy and the framework and get involved for improving the environment or reducing the environmental risks in our environments, in our communities. Healthy People 2030 has 3 goals related to environmental health. I would ask you to please be familiar with these. This is in your study guide. Okay, so please have a look at that. We're going to talk about epidemiology is introduced in this chapter. We're going to talk about it more in chapter 10. So epidemiology essentially is the science that helps us to understand the strength and association between exposures and how they affect us. That's what epidemiology is. Okay, we're going to talk about the epidemiological triangle in chapter 10, right? But what it is, it's a triangle which includes the agent, the host, and the environment. And it talks about the relationships of those 3. So the agent is, let's say, for example, COVID. Okay, it may be whatever the virus, bacteria is, that's the agent. The host is the person, it's us. So let's take COVID, for example, as the agent. The host is us being infected. And then the environment, who knows how that's going to play into it? Okay. Is it an environment that has poor air quality? Is it an environment that, like a long-term care facility that has elderly patients that might be more at risk? So the environment plays a factor in how the agent and the host will handle this kind of epidemiological outbreak. Okay, so we'll talk more about that in chapter 10. So we know that climate change plays a big role in environmental risks, right? We know that climate change around the world is leading to global warming. So that is first and foremost when we talk about environmental health. How do we do an environmental health assessment? Okay, we are going to be looking at things like air, water, soil, and food. Those are the 4 most common areas that we look at when we talk about the environment. Okay. The other area we look at is the setting. What's the setting? Is it rural? Is it suburban? And then we look at it by location. Are we talking about a home, a school, a workplace, a community? Okay, so we have the 4 factors, the air, water, soil, and food. We have the setting. And we have the location. Okay, this is an excellent box here. How to apply the nursing process to environmental health. Okay, because as I've said from week 1, we have to be able to take our ADPI, our nursing process, and apply it to each of the topics we're talking about. So here's a really good example of taking our ADPI and applying it to environmental health. Okay. So assessment, right? We do a history. We find out where they live, what they've been exposed to. Then we do our diagnosis, and then we determine what our goals are. We plan. Okay, and then we apply our plan, whatever the environmental risk is we're talking about. Okay, and you determine that from your community assessment. But this is an excellent way to have a look at how we transform our ADPI into environmental health. Okay. So what we use as part of our assessment is box 8.2. It's called the I Prepare mnemonic. Okay. And you can please have a look at that. Okay. We investigate what the exposures are. You know, have you ever felt sick coming in contact with a chemical? Where do you work? Are you exposed to dust, fumes, radiation? Do you know where to find your MDSD sheet? Everybody know what that is? You should have it in all your employers. Material data safety sheets, where it lists all the chemicals and potential hazardous liquids that are located in your buildings. Do you wear PPE? What do you do with your clothes when you get home if you are working in an environment in which pesticides get in your clothes? Where do you live? This is all about your environmental assessment. What year was your house born? What year was your house built? Remodeling. You know, there's all sorts of codes now that prevent that look at environmental risks. Okay, and you can only use certain building materials. Okay, what are your, I mean, if you were to look around your community right now that you live in, what are your risks? What are the environmental concerns in your neighborhood? And then you also want to look at past work. Where have you worked? What were you exposed to? What kind of activities do you like to do? And then your referrals and resources. Okay. And then the last part of the I Prepare mnemonic is to educate. Do you have resources available for a community that has contaminated water? Do you have resources available to a community that has an older community that has a lot of lead in the older buildings? Okay, and I don't know if we've talked about it yet, but a windshield survey is a great way to start this process if you're the community nurse. Right? It's helpful in understanding the important environmental risks that communities have. Is the community urban? Is it rural? What does the housing look like? Potential waste problems, trash problems. Do you live in a community that has, you know, dumps or incinerating fields? And a windshield survey is simply that. You drive around and do your assessment. Okay, in rural communities, there may be some other kinds of risks, like pesticide, herbicide spraying. Do people use wood-burning stoves? So lots and lots of environmental risks in every community. And then this part of the chapter just goes through more specifically the air, the water, the soil, and the food. I mean, think about, it's pretty obvious about air quality, water contamination, the soil. But food, I want to touch on food. There's lots of environmental risks with food contamination. You know, you go to a restaurant, you just assume that everybody's preparing the food correctly, washing their hands, using the appropriate temperatures. But what happens? Foodborne illnesses, right? Food poisoning. Okay, that's considered an environmental risk. Okay, and then we have the right to know. Okay, there are laws on the books that state that we as community members have the right to know about hazardous chemicals in our environment. Okay, you can even go on to I think it's the EPA website, Environmental Protection Agency, and somewhere in there you can enter your zip code. And you enter your zip code, and it gives you a list of potential environmental risks in your community. But there are laws about communities having the right to know. Okay, and then risk assessment. Okay, what is risk assessment? Probability of something happening, a health threat associated with an exposure. So what is the community's risk assessment? Okay, along with an environmental assessment comes a risk assessment. How at risk are we for water contamination, chemical leak, food poisoning? Okay, obviously the goal is to minimize the risk. Okay, and then there's certainly risks, environmental risks with all the way from fetal development all the way through, right? There are times during fetal development that a toxic exposure will impact the baby's development. Okay. We know that children are definitely more at risk for environmental hazards. Why? Factors such as poverty, lack of access to healthcare, dangerous environmental situations that they may live. And then kids are at risk because of the immaturity of their immune system, especially with respiratory. Okay. Levels of prevention. This chapter is focused on environmental health, so it talks about lead exposure. Okay, so an example of primary would be use only lead-based paint, right? You're trying to prevent something before it happens. Secondary, remember secondary is early identification, early treatment. So you're looking for people at risk, communities at risk. So for secondary, if lead paint is found, remove the paint and replace it with non-lead paint. And then tertiary, we have to assume they have some kind of a lead exposure. And so we treat the symptoms. At the first sign and symptoms of lead exposure, take steps to reduce the blood levels. So they already have the exposure. Risk communication, that's a big role for us. All right, we have to be able to, the community is entitled to know what's going on. Okay, they must know what's going on. They have the right to, there's 3 sections to this. They have the right to the information. They have the right to accurate and relevant information. We have to make sure we get it to the right people. We may not need to panic everybody. Okay, so we have to make sure we communicate to the right people and obviously make sure we communicate at the right time. Timely communication will alleviate fear. Okay. And then advocacy. Okay. There's more than 3 million nurses in the United States today, and we should be a strong voice and a strong advocate for our communities, right? We can work to protect the environmental health of our communities, whether it's an individual, a family, or a whole community. Right? We're nurses are seen as trusted sources of information. People come to us. Okay. So our roles with environmental health in the communities, we're educators, we're advocates, we're communicators. We should be pretty versed on public policy for the environment, laws, regulations that help protect the health of the public. So environmental health is huge in communities. Okay. Here's a nice list of environmental health resources, box 8.5, if you would like to look at that. And then again, I just touched on that, but roles for nurses in environmental health. Community involvement and public participation. I mean, you're it. You're the community nurse. You're the public health nurse. One of your biggest jobs is education. Making sure your community understands the risk. We also have to be able to do our population risk assessment. Risk communication we just talked about. And then we'll talk about epidemiological investigations. A lot of students ask, why do nurses have to get involved in epidemiology? You have to be able to connect the dots, right? Of environmental risks to health. And then nurses also play a role in policy development. Okay, we want to be involved in informing our legislators, monitoring bills that are coming through. Okay, so I would like for you to be familiar with these 5 roles that we play. And we've touched upon each of them. And then always review the remember this. I'm not going to go through it. You can, but please go through that. Okay. So the areas that I highlighted that we just went through are the important areas of knowledge that you need to pull out of this chapter to support being able to answer the objectives and to understand this section on the study guide. Anybody have any questions on environmental health? What are some of the, in the areas that you live in, what are some of the risks? And do you take environmental health for granted in your community? What are some risks in your communities? That's a question for you guys.
Well, in Cookeville, our city just got cited for dumping pollution into the water. We've been doing it for the past decade and been told to fix it. Now the Army Corps of Engineers and a group called the River Protectors have gotten in on it now.
There you go. Thanks, Hunter. Yeah. So that's a perfect example of environmental risks. Anybody else? What about you? Anybody else's community? What are your risks? Nobody else has any risks in their community?
Pesticide runoff from the local nursery.
There you go. Great. I hadn't thought about that, but yeah. What else? Do you guys take your environment that you live in, your community, for granted? Do you just assume somebody else is taking care of monitoring the air quality, the water quality?
To be honest with you,
I do.
don't really think about it. I mean,
Exactly.
Yeah.
You just assume it's all getting taken care of.
Yeah.
I
Until
live
something-
just outside of Pensacola, and we have a lot of tourism. So they come and they ruin our beaches and litter and dump stuff all the time.
Yep. Yep. Anybody else? Okay, let's talk about epidemiologic applications. Okay, I'm going to try to minimize the information here because epidemiology can get kind of overwhelming and wordy. But remember, please review your PowerPoint if you already haven't. Remember, your PowerPoint is your chapter outline. Okay. There are I can tell you right now, we need to know the difference between descriptive epidemiology and analytic epidemiology. Okay, these are right here. This is in your study guide. We need to know the differences of how to do studies. Are they cohort studies? Are they prospective cohort studies, case control? So a lot of this week's information content are definitions, and you'll see that in the study guide. Okay. We need to know this. Whoop. Epidemiological triangle, agent, host, environment. Okay. So again, have a look at your objectives here. That's what we're going to focus on. Okay. Okay, so we talked about in chapter 8, epidemiology. Epidemiology is the study of risk and how it affects health. Okay. That's the simple definition. Okay, so we need to know about two types of epidemiology: descriptive, right here, descriptive epidemiology, which talks about the occurrence as far as person, place, and time. Okay, so we find out who is involved. This is what your discussion question is about. Okay, who, what, where, when. Who was infected? What were they infected with? When were they infected? Okay, the why is the analytic epidemiology. Why did it happen? How did it happen? Okay, that's the easy way to remember. So descriptive, the description is the who, what, where, when, and how, or not how, who, what, where, when. The analytic is why did it happen? How did it happen? So we need to understand the difference between those two. Okay. In your study guide, it asks you to look at the Healthy People 2030 box with regards to epidemiological objectives. So here they are. Okay, reduce the rate of death in adults with diabetes. Pardon me. Increase the proportion of people who wash their hands and surfaces when preparing food. Increase the proportion of people who refrigerate food within 2 hours after cooking. Those are pretty general objectives. How do we use epidemiology? How do nurses, you think, why do nurses need epidemiology? Pardon me. Well, the nurse plays a key role in the team. The public health team. All right, we're looking at health, disease causation, and how to both prevent and treat illness. All right, we are looking at what factors play a role with individuals, families, and the population, because it's a lot more difficult to control the environment versus the hospital setting. Okay, the hospital setting can have controls on air quality, controls on water, controls on food preparation, not so much in the community. All right, it's really difficult to control the environment. Pardon me. Hospitals have a proper way of disposing of garbage and trash. It's not insects and animals that they need to worry about that carry infectious diseases. But out in the environment, it's much different. Right? Epidemiology for nurses also involves surveilling and monitoring. Right? So when I was in school nursing for 20 years, we did a lot of that. COVID for the last 2 years, that's all I did was surveil and monitor COVID cases. Right? But beyond that, you know, if you have pertussis going on in your schools, chickenpox going on in your schools, whatever communicable or infectious disease, our job was to surveil and monitor it, educate, or, you know, tell students that decide what students could come to school depending on the contagiousness of it. But you never really thought about it as nurses doing epidemiology, but that's what we did in school nursing. Monitoring disease trends. Okay. We do this in homes, schools, workplaces, clinics, right? And we identify patterns. So here's the example. If several children in the school become sick with abdominal pain, and within a short period, nurse would try and determine what they had in common. Was it food from the cafeteria? Was it a snack that was given in class? Okay. This is important here. Care of the clients, families, and population groups use the following steps of the nursing process. Sorry, I'm just trying to get over a cold. And here's your nursing process. This paragraph, have a look at it, is how your nursing process, your ADPI, is articulated in the epidemiological world. Okay, when using the nursing process, epidemiology provides your baseline information for assessing needs, identifying problems, designing strategies, and evaluating the problems. Okay. So what are some basic concepts in epidemiology that you need to be aware of? Okay, how do we measure morbidity and mortality? We need to know the definitions of these three: proportions, rate, and risk. So what is the proportion? What is the proportion of people that will get cancer in the next 5 years? Okay, so proportions, what is the proportion? What is the group number of people that will be affected by something? What's the proportion? Right, the rate is the measure of frequency. And these are right here on page 174. Okay, so the rate is your measure of frequency. And then the risk is simply, what is the probability that the event's going to occur? Right, so we need to have an understanding of those three measures of how we measure morbidity and mortality. It's done by the proportion, the rate, and the risk. Okay. Okay, this is a really good box as well to read. How to assess the health problems in a community. Okay, we examine the local epidemiological data. What do we already have? Okay, we can look at cases of hospitalizations, ER visits. I mean, you become an investigator. That's what epidemiology is all about. You become the investigator. Okay, what have you identified of as risks in the community? And what can you do about that to minimize the risk? Prioritizing what are the higher risks all the way down to what the lower risks are. Sorry. I feel like I've been sick all fall. Okay. Here's some other things we need to understand. Common mortality rates. Okay. This is how we determine, this is when you're given the information of, let's say 60% of the population will be diagnosed with something. How do they come up with those numbers? Well, here's how you do it. So for example, the most common one is the crude mortality rate. All right, it represents the proportion of a population who die from a cause during a certain period. Okay, so here's an example. In 2016, there were 2.7 million deaths out of a total population of 323 million. So when you put that in the formula form, you get not 850 per 100,000. Does that make sense? Age specific rate. Number of deaths among people at a given age group. Okay. So the example they give is 20 to 24-year-olds. So 21,763 over a population of 22 million. So 97.2 per 100,000. Okay. The ones I want you to know are the crude mortality rate, the age specific rate, and the case fatality rate. What's case fatality rate? Number of deaths from a specific disease in a particular period divided by the number of people diagnosed. So for example, if 87 out of every 100 people are diagnosed with lung cancer die within 5 years, then you have a 5-year case fatality rate of 87%. Or look at it the other way, a 5-year survival rate of 13%. Does that make sense? Here's your epidemiological triangle. This starts on page 178. Okay, and as I told you, it involves the agent, the host, and the environment. Here's a definition of each of them. So I want you to review this, and we'll review box 10.1. What is an agent? All right, the agent must be present for a disease condition to develop. All right, so if you look at what are some examples of agents here in box 10.1, let's look at those. It could be infectious disease or infectious agent, bacteria, virus, fungi, chemical, pesticides, or it could be physical agent. Temperature extremes, machinery, radiation. Right, so agent has to be present for any kind of condition to develop. Then you have the host, which is your living species, human or animal. We have to be capable of being infected by the agent. What are some examples of a host? Okay, assuming it's a living species. Okay, a host could have different characteristics. So I'll speak for myself. I could have a genetic susceptibility to something that has been a health issue in my family. Okay, my age or my sex may have an impact on how I am affected by the agent. Maybe your immune status will have an effect on how you, it's so fresh in our minds, but COVID. You know, let's assume we have COVID as our agent. Host, are there parts of the population that have a more susceptible? Yes, probably the elderly, the with COVID, sex doesn't seem to play a factor, but susceptibility, immune status, or the people that have low immune systems get more sick. Are they more sick if they catch COVID? And then lifestyle factors. It was determined through COVID that the obese population, the diabetic population, were much sicker with COVID. And then your environment. Well, how does your environment play into it? I don't know. It depends. Are there issues with heat and cold? What's the climate in your environment? Do you live in a crowded environment where things like COVID can spread quickly? Are there support systems? Are there resources? What's some of the socioeconomic factors? Access, education, and then what are your working conditions? So all these three, agent and host have to be present. There has to be an agent that infects a host. The environment, who knows? Whatever's going on in the environment, internal factors, external factors will affect. So think about all the scenarios we had for COVID. We knew that the elderly population was at risk. We knew that the children were not so much at risk. We knew that immunocompromised were at risk. Obesity played a factor, diabetes, comorbidities. Okay. And there's no one, I mean, if you put all the different possibilities between these three, there's tons. You just have to evaluate each one. Maybe healthy people didn't get as sick from COVID. Other people did. In the environment, if you were in a long-term care facility, you seem to be more at risk for getting it. Does that make sense? This is an excellent summary. I encourage you to read it. It goes through, and I know it's about epidemiology, but it goes through primary with regards to epidemiology, primary. This is one of the few chapters that it's actually spelled out other than just a box. Okay. Okay, so we know with primary, what are we trying to do? We're trying to promote health and prevent occurrence. Secondary, we're trying to increase the probability that a person with a disease will have a condition that's treatable. That's early diagnosis, early intervention, right? And then tertiary, we know that we aim at preventing, trying to manage it, trying to limit the disability, limit the long-term effects, enhance rehabilitation. Okay. Okay, couple of sources of data we need to know. Okay. So it's important to know how we collect data, right? Because remember, you're the investigator. I was the investigator as a school nurse. Okay. There's three major sources that are commonly used in epidemiological investigations. Okay. We have number one, routinely collected data. Okay, which is data that's already present. Okay, census data, vital records, surveillance data. Okay, it's already readily available to us. Okay, then we know we can collect data from other purposes. Okay, medical, health department, insurance records. And then we can also collect data from other specific epidemiological studies. that have already been done. So that's all I need you to know is the 3 sources of data. Routinely collected data, data collected from other sources, and then original data from other studies. Okay. And then I asked you, hello?
Yeah.
Do you have a question?
Hello.
Hi. I asked you at the beginning of the chapter, or I told you we need to know the difference between descriptive and analytic. Okay, so we taught, this is it more in depth. Okay, descriptive epidemiology means the who, what, where, when. Okay, who is infected? Where were they infected? When were they infected? This is your discussion question for this week. Okay, and then analytic, right here, looks at the how and the why. How did this happen? Why did it happen? Okay. The rest of this section just describes all of these. Person, place, time. How, why. Okay, you don't need to read this whole section. What I need you to understand is the difference between descriptive and analytic. Okay. We need to know about a couple of epidemiological study designs. So how do you do it? How do you, so for me as a school nurse and for nurses in general, one of the easiest and most just quick, easy way to do a epidemiological study is the ecological model. Okay, so if you're asked about what do nurses like to use, what's the most common design, common study design nurses use? It's the ecological. It's quick, it's easy, and it's inexpensive. And it typically uses readily available data. Okay. But there are also a few other designs. Okay, and this is in your study guide. You need to understand what the cross-sectional design is, the case control design, and I just need you to know the general, probably the first bullet of each one. That's what I need you to know. Okay, I need you to know that there are different designs. So if you're given a question about using an epidemiological design and you're given a scenario, would you be able to identify which of the 6 these were? Okay. And if you know the first bullet of each of these, you'll be fine. Okay. But for nurses, this is the best to use, the ecological. Easy, quick. Data is usually right there for you. Okay, and then it goes, that discusses all of these in more detail. You don't need to read all through this. Just please study this table, 10.3. Okay, let's review the levels of prevention. Okay, here it's related to cardiovascular disease. Okay, primary, discussed with clients a low-fat diet, need for regular physical exercise to prevent cardiovascular disease. Right? If we find that we have a group of our community that's at risk, a secondary example would be implement blood sugar or cholesterol screening. Do a treadmill test. Try to identify those at risk that are going to be at risk for cardiovascular disease. And then tertiary, they already have some kind of cardiovascular disease. Okay, so you're going to be maybe providing rehab, cardiac rehab, medication, surgery. Okay. And then I'm not sure, there's a lot of information in here. I don't want to confuse you. I would just, I know I'm always recommending, remember this, you can read through it, but remember what we pulled out of this chapter. We didn't pull everything in this remember this out of the chapter. Okay. Talks about, here's your analytic, here's your descriptive. Okay, so review what we actually studied in this chapter. Okay, so we don't need to know this whole chapter. Okay, so any questions about epidemiology? And then let's talk about the occupational nurse. What does an occupational nurse do? What's
Just a
occupational health?
nurse that can work at like a prison or a jail.
Mhm.
Okay.
Occupational health is about the workplace. Doesn't matter what your workplace is, whether it's a fast food restaurant, whether it's a jail, whether it's a hospital. Okay. So remember, your PowerPoint is your chapter outline. Let's take a look at our objectives. What's the nurse's role in occupational health? What are the current trends? How do you do an occupational health history? Okay, so we know that occupational health is about keeping workplaces safe and promoting healthy work environments. Okay, we know that we spend approximately 1/3 of our life at work. Okay, we should be able to feel healthy and safe. We know that no work environment is completely risk-free. Right? We need to have some, as nurses in the community, we have to have some knowledge about workforce populations, hazards in the workplace, methods to control those hazards. So let's say I'm working in a car factory plant. I need to know who my population is, what the risks of my population are. I need to know, how do I reduce accidents? I need to know who has prior health issues to make sure they can work in that environment. I need to try and prevent work-related illnesses. I need to also try and create environments that are focused on primary preventions, supporting health promoting activities. Right? Occupational nurses play a critical role in delivering workplace safety, health and safety guidelines. Okay. So here are some roles of the occupational nurse. Promotes health and safety of workers, defines the scope of practice and sets the standards for the workers. Code of ethics. You know, each type of nursing has their own code of ethics. So does occupational nursing. Ongoing continue education to keep up to date on the specific policies and laws and acts that are constantly evolving to help with workplace safety. Okay. So workers as a population aggregate. Okay. So here, this is a list of some of the more common occupations that have maybe increased risk. Okay. Mining, utility, you can go through the list. Think about it. Mining, utilities, construction, manufacturing. Okay. Lots of additional risk in some of these occupations. Traditional automotive plants, healthcare, restaurants, agriculture, construction. So this is the list I actually want you to look at. These are the most common areas with higher risk. We know that the workplace is changing over time here in the US, changing rapidly, actually. Okay. We know that here's some examples. Jobs in the economy continue to shift from manufacturing to service, longer hours, longer shifts, part-time temporary work, new chemicals, materials, equipment. Okay, we know that as the population in the US increases, the US workforce is expected to grow as well and will become older and more racially diverse. More women in the workplace, older individuals in the workplace, people with chronic illnesses. All right, so that's the responsibility of the occupational nurse. And let's pull back in the epidemiological triangle. How does it relate to occupational nursing? Well, we have agents, biological agents, chemical agents, ergonomic agents, physical and psychosocial agents, right? All those are risks. Who are the susceptible people? The workers and maybe the workers' families. And then we have the environment. Depending on which kind of environment you're in, will depend on how the agent and the host, how ill you are or not so ill. All right, so we're shifting into, we're thinking about the epidemiological triangle in terms of occupational health. There's lots of risk factors in the workplace. And here, I'd like for you to review this box, please. This is those 5. Right here. Workplace hazards. Here's a definition of the 5 of them. Okay, page 581. What are some examples of biological infectious hazards? Bacteria, viruses, infected people, or contaminated body secretions. Some chemical hazards, vapors, gases, aerosols. And then the enviromechanical hazards, potential accidents, injuries, strains from lifting, slippery floors, physical hazards, right? Are you working with radiation, electricity, extreme temperatures? Are you working in a place that is real high noise level? And then your psychosocial hazards related to your work environment. Is it a stressful environment to work in? Is there emotional strain or interpersonal problems? Remember, people spend 1/3 of their time at work. So are they bringing their interpersonal or issues outside the work to work? Okay, very, very lots of things to think about with environmental nursing. And this is interesting if you want to have a look at this. You don't need to memorize any of this, but selected job categories. What are they typically exposed to? And what work-related diseases or conditions might they develop? I found this interesting. Glass workers, right? Their exposures are to heat, solvents, metal powders. What are they likely to develop? Cataracts. Okay, interesting, very interesting list. And then it goes through talking specifically about biological, chemical. You don't need to read through all that. I just need you to know what the 5 common issues are. Okay, and here's a longer description of those. Okay, there is obviously organizational, where you work, public efforts to promote worker health and safety. Right? Obviously, the goal is to have your workers healthy, have them safe. Okay, so here's where OSHA comes in. Okay, what is OSHA? Occupational Safety and Health Administration. Okay, concern over health and safety in the workplace. Okay, OSHA is kind of the enforcers. At the federal level, they're going to give all sorts of workplaces guidelines about safe practice. What's safe practice in a restaurant, versus what's safe practice at a, I don't know, hair salon. Okay, OSHA is there to make sure that the place of business, the workplace, is following the safety guidelines. Does that make sense? Hospitals have different sets of rules than restaurants, than banks, than everybody has their own set of health and safety guidelines, every work environment. OSHA makes sure that you are doing it. So if there's like an accident on site, if there's a, I don't know, some unexpected deaths in a hospital after surgery, there's foodborne illnesses that occur in a restaurant, they're going to come out and investigate all that, right? They are there to monitor the health and safety standards. Okay. Levels of prevention. When it comes to occupational health, this is a good one. You know, think about primary, secondary, tertiary in regards to occupational health. Right? So maybe in occupational health, we're in the workplace, we're going to provide education on PPE to prevent any kind of injury or exposure. Maybe we're going to do screening, secondary, for hearing loss if you're working in a plant that has high noise levels. Right? And then tertiary is maybe you are working with a group of employees where you work that has diabetes. Okay, you're working with them, they already have diabetes, but you're, I don't know, let's say there's an increased absenteeism with this particular group. Maybe you're going to work with them to make sure they know how to manage their blood sugar. Okay. Okay. Healthy People 2030 and your objectives related to health, occupational health. Okay, have a look at that. Okay, and then you remember this. So occupational health is all about the health and the safety in the workplace. The occupational health nurse plays a critical role. Think about it. Questions about occupational health. So we've covered a lot. Lots of risks in the environment. Lots of risks in the workplace. And if you're working in the community, in some way you will be involved in epidemiological studies, whether you know it or not. All right, like I said, as a school nurse, I might as well have been an epidemiologic public health nurse for the last 2 years in COVID. Okay. Any questions about those three topics? So let's pull up our attestation and let's do that now. And somebody read the questions. And then we'll go take a look at the study guide. What's the first question? Anybody?
I was talking, but I was on mute. What
Okay.
are the three elements of the epidemiological triangle?
What are they?
Agent, host, environment.
Mhm. The agent, the host, and the environment. Does it ask you to give an example of one, Dawn, or just, is that question 2?
It's question 1. It just says, what are the three
Okay,
elements?
so agent, host, and environment. And then what is the second question?
Within occupational health and the changes in the nature of the work, there have been many new occupational hazards identified. Please name 3.
Okay, so what are 3 occupational health risks that have been identified? Injuries, right? Noise levels?
Illnesses.
Go ahead.
Illnesses.
Illnesses. We just went through it. Think of all the risks that are associated in occupational health. They were, well, there were the fancy names for it, which were, what were the 5 of them? There were 5. Physical, psychosocial, chemical, right? Biological. What was the 5th one?
Chemical.
What?
Chemical.
Chemical. So biological risks, chemical risks, physical risks, psychosocial risks, and there was one more.
Is it the environmental one?
Okay, right here. Environmental. So box 32.1 is your answer to question, attestation question 2. You see that? Oh, I'm not sharing my screen. Sorry. Or did I share my screen? Did I share my screen? No, here you go. Where is it? Right here. There's your categories of work-related hazards, your 5 of them: biological, chemical, environmental, physical, and psychosocial. Occupational nursing is hard. Let's say you work in a big company. Like say you're part of the occupational health team in a big hospital. Think of all the risks, all the different kinds of employers, all the different job titles, job descriptions. Everybody has their own set of risks. Okay, so hit submit when you finish that. Make sure everybody put their name in the chat, please. Make sure you try and get to a review if you can. Let's pull up the study guide.
I have a question if I missed it earlier. I don't know.
Yep.
The reviews, are they gonna be recorded and sent
Yes.
for us to watch after?
Yep.
Okay.
Yep. Just like exam one. Yep.
Okay. For exam one, I was only able to find one, which that's why I was asking.
One?
Yeah, I think no, it was yours and one other person, Arjun Stahl or Arjun Stahl.
Alani?
Yes. Yeah.
Okay. Well, I will make sure, but yeah, you should have 6 opportunity. Well, you only have 5 now because I did one this morning. But after class, I'll send you out the recording from my morning review.
Okay. All right.
Okay.
Thank you.
Yeah, you're welcome. So a lot of chapters being covered here, weeks 3 to 5. Lots of chapters. Okay. Remember, I think I did this with exam 1. You can't change your answers. You can. Don't change your answers. Well, Nikki, this is going to be kind of a review for you, but can't change your answers. Make sure you convince yourself of why they have to be changed if they have to be changed. Try and read the question, come up with an answer in your head, and then look at the answer. See if your answer's there. Try and look at it without try and answer it in your head without the answers, looking at the answers. Don't spend too much time on a question. Read it a couple of times. If you have no clue, just answer it and move on. It's only one question. Don't stay on a question for 10 minutes. All right. It's just going to increase your anxiety level, decrease your confidence. Okay. Nikki had a good one this morning. Oh, eliminating wrong answers. Right? You should be able to eliminate at least one answer right off the bat, maybe 2. Try and get those out of there, cross them out, so that when you reread the question, you only have 2 choices. And please, please look for important words and phrases in your questions. What's the least? What's the most important? What's the first? What's the last? What's the greatest? What's a priority? You got to pick out those words. When I do reviews, it makes me absolutely nuts. Okay. There are words in every question that are keywords. You got to be able to pull out those keywords or phrases. And be careful that I didn't mention this morning in my review, but be careful of those questions that are asked from a negative. And what I mean is, what did the parents say to you that you know requires more education? So what are we looking for? The parent said something wrong, right? Or what did the nurse say that we know requires more education? So let's say you're observing a nurse doing discharge teaching. What did the nurse say that you know requires more education from the nurse? So she said something incorrect. So that's the negative way of looking at it. Does that make sense? It's really important because there are some questions that are asked the negative way. And I don't know, I haven't come up with a better word yet about negative, meaning you guys know what I'm saying, right? Be careful if a question is phrased that way. What requires more teaching? What did she say that was wrong? Okay. So actually, what she said was wrong is the right answer. Okay. This is the same cover sheet. Okay. It's broken out. I just highlighted from this morning. broken out into certain concepts. Rural migrant health. Okay, look at the first part of each of the bullets. That's what it's asking you to do. Review the consequences of poverty in rural areas. Gives you a little synopsis of what are the consequences of rural areas. What are the physical demands of harvesting crops? Gives you a little synopsis, but that's all it is a little synopsis. The study guide was pulled from your notes, from PowerPoints, from readings, from lectures, from the actual exam. So this is just a summary of what we've been covering. So my suggestion is that, you know, it says on here, you should be reviewing recordings. If you missed class, watch a recording. If you missed part of class, go back and find that recording and review what you missed. Okay, your projects and your homework and your discussion questions are all contributing to this as well. Okay, attend review sessions, listen to recordings. Okay. So, you know, pick out the important part of each bullet. Identify health risks for clients in rural communities. Know the barriers that exist. Review, here's one, primary teaching, primary, secondary, tertiary, healthy people 2020 objectives regarding pesticide exposure for migrant workers. It's pretty specific to me. You got to know that box, that healthy people 2030 box in your rural migrant chapter, right? Know the cultural considerations regarding the Mexican culture. If the summary underneath the highlighted part, if you're still not understanding it, you need to go back to your notes, your book, your lecture, your PowerPoint, and get the additional knowledge that you need. Okay, and then the next section is vulnerable populations. Here's what you need to know. There's a bullet about HIV, there's a bullet about homeless, single motherhood, alcohol, substance abuse, mental health. Review the psychological dependence, how psychological dependence can occur with chronic use. It's telling you what you need to review. Okay, goes into the faith community nurse. What's the difference between religiosity and spirituality? We already talked about that. Couple of bullets about Medicare, Medicaid. What is skilled care? Who reimburses for skilled care versus non-skilled care? It's all right in here. Then this is what we covered today, environmental health epidemiology, right? We need to know the difference between analytic and descriptive. We just talked about that, the who, when, what, who, what, where, when versus why. Know your agent, host, and environment. Be able to give an example of each. And then remember those rates that I asked you that I highlighted? Case fatality rate. Okay, that's the big one. We know, we talked about today, individuals with immune deficiencies are at higher risk for illnesses with environmental risks, right? With air, with water, with food, soil. Maybe who's at risk? Clients with AIDS, clients who, what does immunocompromised mean? Maybe somebody with AIDS, somebody with getting chemo, organ transplant.
Speaking of, I have a quick question regarding that. This was yesterday at the hospital for clinical. I had a patient who was a 2-day post-op kidney transplant, and then my other patient had the flu. Wouldn't that be like contraindicated? You wouldn't give a nurse those two patients as an assignment?
Not necessarily, because you should be taking the protective, you should be protecting yourself with PPE so as to not infect the other patient. Good hand washing, PPE, using your universal precautions protocols.
Okay, I mean, yeah, I don't know. I just, never mind.
No. That's a good question. But it's a good question.
I understand why the PPE is in effect, but I don't know. It was her second kidney transplant. So I was just thinking to be on the safer side of things. I don't know.
I know what you're saying. Also in Hearst, I remember it talking about something like that, how you wouldn't put those kind of patients together or with the same nurse.
If I were making assignments on the floor that day, I wouldn't assign you those two different patients. Did you and your clinical instructor have a discussion about that?
Later on, yeah.
And what did she say?
She said that's something the charge nurse should have taken care of, and that is something that the nurse that was working should have addressed it with the charge nurse, because it wasn't my instructor's job
Sure.
to do that. She was just like, okay, pick one then. Stay out of the other room. Because I'm a student type thing.
Yeah. Yep, you guys, when you guys get out in the real world, those things are going to be happening. I mean, I wouldn't have assigned you those two patients. Yeah, interesting. This is asking you to review Healthy People 2030 objectives for environmental health. What does that mean? Go back to chapter 8, review your Healthy People 2030 box. What are their objectives as it relates to environmental health? And then we just discussed this. What's the role of the occupational nurse? We just talked about that. Know the principles of the triangle. We already talked about that. Agent, host, environment. Oh, I didn't cover incidence, risk, and prevalence. Okay, please go back and review that. Be able to define, give examples. This is in your epidemiological chapter, chapter 10. There's a section on how to measure the incidence, the risk, and the prevalence. And it's more definitions. What is the definition of incidence, risk, and prevalence? We talked about the different kinds of designs. The ecologic, remember that easy one, easy access to information, easy, quick, doesn't cost a lot. And then cross-sectional and retrospective. So it's asking you here in the study guide to know these three. Give an example of one. That's right in that box in your epidemiology chapter. Okay, and what is the World Health Organization's mission and principles? This is in your study guide. How does this apply to Healthy People 2030 initiatives? Okay, this is in your study guide. And what's the World Health Organization's mission is to have the whole world be healthy. Okay, and they have a few principles. I don't have them memorized, but you're going to have to go back to the 2030 initiatives. And then we talked about the function of OSHA with regards to occupational health nursing. They enforce the rules and regulations. Okay, so I really don't want you to consider this a review in any way. I just wanted you to show you how it was set up. Okay, so it tells you right on the study guide what you need to do. Review this, know this, define this. And as I say with all my exams, if you have an excellent understanding, not memorization, But if you have an excellent understanding of the study guide, you can do great on the exam. Okay, whatever doesn't look familiar to you on the study guide right now, you got to go back and do some more reading. And if at the end of studying, reviewing, you doing your due diligence, you still don't understand some information, set up an appointment with me before the exam, and we'll review whatever you don't understand. Helpful? Okay. Anybody have any questions?
No.
Okay. Well, I'll stay on for anybody that has any questions. You guys have a good rest of the week, and we didn't cover Kahoots, but I think you have did I send you a week 5 Kahoots? Okay, if I didn't, I will. I need to go back. I think I'm not even sure I sent you a week 4.
I think there was a week 4.
There was a week 4 Kahoots?
I believe so.
I
I'm
have
not
a week 5 too. So when I send,
Or we did get the 5.
okay,
Yeah,
so when I send out this recording for this class, so look for 2 things from me today. I'll send out the recording from the class and I'll add the week 5 Kahoots to that. And then I'm also going to send out the recording from my review this morning. Alrighty?
All right.
Okay. And then hopefully you can get to review later on in the week. You should have the master schedule. But you guys have a good rest of the week, and please reach out if you need anything, okay? Good to see everybody today.
Thank you. Have a good day.
Oh, you too. Thank you.
Professor Monroe.
Hi. One sec.
Hi.
Hey, 1 second.
So
I'm going to just stop the recording.